Hi, my name is Clarissa Story.
I'm Scott Capece.
And we're graduate students at the University of Louisville Audiology. We're here today to talk about your hearing. All right. So you might have said this before. Say, I'm having trouble hearing at home, out in public, and at my workplace. It sounds like people are mumbling or I hear them, but I just can't understand what they're saying. What does this mean? So as audiologists, the #1 complaint we get from patients in our clinics is that they have been having trouble understanding their family, friends, and coworkers. For many people, this is the first indication that they may have hearing loss. However, the only way to know for sure is to visit an audiologist and to complete a full diagnostic hearing test. And this typically includes a hearing test in a sound booth and an evaluation of your performance with different hearing aids or amplification devices. Also, whenever you see your audiologist, make sure that you tell them all the places that you have been having trouble. It really helps audiologists to know the specific places so that we can then try to improve those places for you.
Now let's say that we find that you do have hearing loss. Now you may be wondering what you can do about it. Well, hearing loss is a wide spectrum, and there are many different devices that we can fit for your specific needs. For most degrees of hearing loss, hearing aids are the best option. And then those hearing aids come in many different sizes and shapes, ranging from devices that sit on top of your ear to devices that sit completely in your ear canal. The device for you is ultimately based on your hearing needs and preferences. In cases of more profound hearing loss, a device called a cochlear implant is the most appropriate option. Cochlear implants are a more invasive technology that is surgically implanted under the skin with an exterior component that attaches magnetically.
So you might be asking, what caused your hearing loss? So there are multiple and many causes of hearing loss. Some causes are preventable and others are less so. A major factor for hearing loss is long-term exposure to loud noise. So that would be something like military experience or working in heavy machinery, or even if you work, with a lot of noise in your environment, such as IT departments that have, loud fans and loud noise. Just knowing where your environment is and knowing how loud it is in your environment, that really can affect your hearing. It's really crucial to wear hearing protection or if you are in those loud environments, because you want to protect the hearing that you have. Your hearing, once it's gone, so we want to make sure that we protect it. Even listening to music in your car at a loud level can lead to a really bad and permanent damage. So you want to make sure that you are listening at an appropriate level. Other cases of hearing loss can include your age, your genetic disorders, or any kind of physical trauma to the ear. So again, make sure that your ears are staying nice and healthy.
Our patients with hearing loss sometimes worry that their hearing will get worse, and that's a very understandable worry because no one wants to have worse hearing loss as they age. But this can be something that's difficult to predict. While we do hope that your hearing remains stable, there are some factors that can influence or change your hearing. However, if you feel like your hearing has changed, it is very important that you see an audiologist to make sure that the status of your hearing has not changed.
So there is always a worry about how much hearing aids cost. So the cost of hearing aids kind of depend on the level of technology. The device that's best for you really depends on your lifestyle and your budget. For those who live really active lives and find themselves in many social situations, there's something called the premium level technology, and that really just is considered the chip inside. And the only thing the chip inside does is it's the best speech and noise capability, and it continues to scan your environment to give you the best audibility. But for those who do not need, the advanced technology to, and really aren't in complex listening environments, the cheapest option with basic features is the most practical. So if you're a homebody and enjoying just being home and reading a book and not having to worry about trying to listen to someone across the table from you, really the basic technology is the best. Technology typically costs under $1,000 per device. And then the most advanced features with the most premium technology is about $4,000 per device. But that also depends on the audiologist that is fitting you and where the services are, because some have bundled and unbundled, and that's also something that your audiologist will be able to go through with you.
Now you may be wondering if your insurance will cover the price of those hearing aids, because really they're not cheap, unfortunately. But there are some plans that will cover the cost. While some will not. And that really just depends on the plan that you have. If you are wondering if your insurance coverage will take care of the price of the hearing aids, that's just something you'll have to reach out to your audiologist to figure out.
So we don't only test adults, we also test children. So a number of audiologists can test children. We do a number of different tests. Make sure you talk to your primary care doctor, however, if you have concerns for your child's hearing, because they are, the first step into getting that referral that's either needed due to your insurance, or to be able to reach out to us if there's anything that could cause kind of temporary hearing loss, such as like maybe an ear infection or just maybe some earwax. And those are things that your primary care doctor can take care of. However, if you do notice that maybe your child mumbles or they don't talk as much as they used to, or they, itch and pull at their ears, that's a really big sign that something might be going on. So please, again, reach out to your primary care doctor or to your audiologist, and we can do a fun little hearing test.
So a very common complaint is people tell us that they have ringing in their ears and they just don't know what that is. Well, it's known as tinnitus, and it actually affects up to 20% of all individuals. While there are many theories for the cause of tinnitus, we still don't fully know where that ringing actually comes from. Even people with normal hearing can have tinnitus. If you have tinnitus, you should have your hearing evaluated. And for those whose tinnitus is actually unbearable, there are a few different therapeutic options for you.
Another common complaint is dizziness. And what's kind of unknown about audiology is that we also specialize in balance disorders as well as treatment of those disorders. Only certain audiologists, although, possess the equipment to be able to do these tests. So to be sure to check with your audiologist to see if this is an option for you, or if not, you can find a referral to another audiologist within the area that has this equipment. So please, if you are having any of those dizzy symptoms, please reach out to us. We'd love to see you.